Now, precious, listen. As it is time for you to pierce your baby's ear, I have something to tell you. You have to be very careful, okay, when handling the baby's earlobe after the piercing. You have to ask the nurse or the carer how to care for the area. Okay, now this is an earring. I want to show you something. Now, precious, this is an earring, okay? Now I will take out the stopper from it. This is how to do it. After the piercing, when they are putting in the baby's earring, although the nurse or the piercer will do this, but make sure that the stopper is far from here. Now, when putting in the earring, you put it this way. Although the other full stop, the other earring has a place where you would stop, it will not go further. Now, when you do it, make sure there is a space in between, a space in between. It should not be very tight because pressure from tight earring reduces blood flow to the earlobe. If it is tight, you would notice after some time, you would notice that the baby's ear, the earlobe, is getting swollen. If it is tight, you will start noticing that the skin around the piercing is swollen or reddish in color. It will start changing to red color, and then you will start seeing pus actually coming out from it. And in most cases, if you don't notice it on time, it will start smelling because the area will be swollen and reddish, and pus will be coming out. Now, if it is too tight like this is what you start seeing. And if care is not taken, it will start decaying. And then the earring will fall off and the earlobe will become wide open. How do you avoid this? Make sure you ask the nurse or the piercer how to care for that area after the piercing. And secondly, after the piercing, make sure that the stopper is not too close to the earring. That is not what I mean is it is not tight. Make sure there is a wide space in between. When you put it, you would notice that the back is still there is a space before the stopper to prevent the earlobe from becoming swollen. So you have to move it back because any pressure from tight earring will reduce blood flow to the earlobe and it will cause harm to the baby. And if you notice anything like that, swollen earlobe or pus, or you're seeing any reddish thing or anything coming out like water from the earlobe, please take the child to the hospital to see a pediatrician immediately because any break in the skin can become infected. Any break in the skin can become infected. So to avoid the earlobe being infected, please take the child to the hospital to see a doctor. And before then, if you can remove the earring, just do it immediately. Because that pressure is very painful. Do you know that in most cases, when children after piercing, they cry a lot? A baby that the ear was pierced, the baby was in serious pain. Nobody knew that the earrings were tightly locked, that the stopper was so tight to the skin, preventing blood flow to the earlobe, which led to the pus coming out. And the baby was in pain. And at that point, nothing could be done because it was already tight. We tried to pull it out. We had to quickly do something about it. So please ask your nurse or the piercer how to take care of the earlobe or the area, how to clean it dry, and how to take care of it to avoid being infected. Thank you very much.